Good evening and welcome. I'm Mamta Rawat from the corporate communications team of CareEdge. I welcome you to our discussion today on Indian hospital industry, empowering health and enabling growth. We sincerely appreciate your time in joining us for this webinar. We would like to welcome our esteemed guest speakers for today. Ms. Ruby Ritolia, Chief Financial Officer at Healthcare Global. Dr. Vishal Arora, Chief of Business Transformation and Operational Excellence at Artemis Hospitals. Mr. Abhishek Singh, Executive Director at Deloitte. This session will be moderated by Sabyasachi Majumdar, Senior Director at CareEdge Ratings. We will commence the session with a presentation by Bhawna Rustagi, Assistant Director at CareEdge Ratings. This will be followed by a panel discussion and a Q&A session. In case of queries, participants are requested to key into your panel. We will take up your queries at the end of the discussion. Now, may I invite Bhavna to make the presentation?
Thanks, Mamta. Good evening, everyone. India's hospital sector is rapidly growing due to economic, demographic, and policy factors. Rising income levels and wider access to health insurance are reshaping the consumer preferences towards private healthcare providers. The sector has seen increased consolidation as well. Considering these developments, we at CareEdge Ratings thought this is an opportune time to share our perspective on Indian hospital industry and also understand from industry experts on way forward given the current landscape. The key messages for today's webinar are rising demand supporting the occupancies for players, especially in gateway cities. Long-term potential expected to sustain with increased government investment and rise in medical tourism. We will then have a look at emerging trends and how are they reshaping the sector. Operating margins expected to stay strong and improve marginally with operating leverage playing out. Revenue to register 11 to 12% growth. Further, the free cash flows which players reported in last 2 years have given reason to capex intensity in the sector. Players across the board are expanding and credit profile is largely expected to remain stable. The total market size of Indian healthcare industry stands around 10 lakh crores. Hospital contributes a major share in the healthcare industry, that is about 58 to 60% at rupees 5.8 lakh crores, following by pharmaceuticals, and the remaining market is contributed by diagnostics, medical equipment, health insurance, and others. The chart on the right-hand side presents the compounded annual growth rate of the hospital industry during pre-COVID, COVID era, and post-COVID. It is observed that the industry during FY14 to FY20 has reported a CAGR of about 10%. However, during COVID, the growth of hospital industry was impacted as the patients have postponed the elective surgeries. Nevertheless, with subsiding of the COVID, the growth of hospital bounced back and thus reported CAGR of about 11% during FY20 to FY24. Going ahead, key structural drivers such as aging population, increased incidence of lifestyle diseases, greater healthcare awareness, and technological adoption are expected to aid the industry in clocking 11 to 12% CAGR over FY24 to FY27, reaching 8 to 8.5 trillion. We will discuss these in detail later. Let us first have a look at the industry landscape. Exhibit 1 presents the percentage share of private hospital to government hospitals. Indian hospital sector is more skewed towards private hospital, which contribute about 65 to 70%, while the remaining 30 to 35% is by government hospitals. The capital expenditure on healthcare in India has though been rising, but historically remained in the 2 to 4% of GDP range. And when we compare this to global total, as has been shown in Exhibit 2, India's healthcare expenditure is significantly lower than the global average, as well as that of many developing countries like Mexico, Brazil, Russia, Thailand, etc. With significant lower spend on healthcare, let us also have a look at the bed density and staff penetration. The adequacy of country's healthcare infrastructure and personnel is a barometer of its quality healthcare, which can be assessed from bed density, which is bed count and availability of physicians and nurses per 10,000 population. Though India houses nearly one-fifth of world's population, it has one of the lowest bed densities as can be seen in Exhibit 3. Situation in rural areas is far more worse than urban places. Further, with only 7 physicians and 17 nursing personnel per 10,000 population, as shown in Exhibit 4, India lags behind the global median of 18 physicians and 30 to 35 nursing personnel. This is even lower than the ones in developing countries per 10,000 people. And hence, there is a high scope for improvement and room for more beds and personnel in the country. Having a look at how the scenario is currently, let us take a dive into what the fundamental and structural growth drivers in this industry that shall support the capacity expansion in the sector. The prevalent structural and fundamental growth drivers offer huge potential to drive healthcare delivery market in India. Amongst the fundamental growth drivers are aging population, rise in income levels plus insurance penetration, increase in public healthcare expenditure, surge in medical tourism, and growth in communicable and non-communicable diseases. With increase in life expectancy and more number of people going forward entering into the age group of 50 to 70 years in next decade, wherein the need for medical emergency arises, would act as a major growth driver for the industry. Apart from that, rise in income level, increase in insurance penetration, and increase in expenditure by government would act as a tailwind for hospital industry to grow. We will speak about these in a detail in upcoming slides. India has seen gradual uptrend in medical tourism given the relatively low cost of surgery, critical care, and advanced technology hospitals. We shall be delineating on this aspect more in detail in subsequent slides. Let us now take a look how the insurance penetration has been trending in India. Low health insurance penetration is one of the major impediments of growth of the healthcare delivery industry in India, as affordability of healthcare facilities by lower income groups remains a concern. As per Insurance Regulatory and Development Authority, close to 50 to 55 crore people have health insurance coverage in India as of 2023, as against 20 crores in 2014. Despite this, there has been a significant growth in the penetration, but is only at 39% as of now. Increasing premiums has direct correlation with growth in healthcare sector, as it will result in a higher affordability for the patient pool. The total health insurance premium collected remains concentrated amongst the top 5 states. However, these states account for only 27% of India's population. As a result, there is still a sizable population that is yet to be tapped, which will keep fueling growth in the hospital space. In Exhibit 6, gross premium over all these years has been depicted. Health insurance premium increased with a faster rate due to increase in premium by insurers in last 4 to 5 years and reached to 90,000 crores in 2023. And the premium has grown at a healthy rate of 19 to 20% over the last few years. With increase in awareness of the importance of health insurance policy, we estimate that the insurance premiums to grow at a healthy CAGR of about 20% during next 2 to 3 years, which will continue to act as a growth driver for the hospital sector. The government introduced its flagship Ayushman Bharat scheme and is gaining healthy traction as shown in current slide. Government is promoting medical tourism via Heal in India initiative. Ayushman Bharat, the flagship health scheme of the Government of India, was launched as recommended by the National Health Policy 2017 to achieve the vision of universal health coverage. Ayushman Bharat PMJ is the largest health assurance scheme in the world. Exhibits 7, 8, and 9 in current slide give the relevant year-on-year data. It subsumed all the earlier schemes of government. As of FY24, over 29,000 hospitals have been empaneled and over 7.37 crore admissions done till June 2024 with a higher number of admission in FY24. It provides a health cover of rupees 5 lakh per family per year for secondary and tertiary care hospitalization to cover 12 crore poor and vulnerable families that forms the bottom 40% of the Indian population. India today sees great influx from the medical tourism. India also has the potential to become hospital for the world. Previously, international patients coming for medical treatment in India used to face various regulatory hurdles, like regular police inspections, etc. This used to discourage the patient category to opt India as a medical treatment destination. But in recent years, medical tourism in India is on a gradual uptrend, given the relatively low cost of surgery, critical care, advanced technology hospitals, and e-medical visa. In Exhibit 10, medical tourism has been on rise in India till calendar year 2019, before plunging by almost 74% in the COVID-struck year, the year which marked ban on travel and various other restrictions. Post-COVID year 2021 registered growth in medical tourism. It was, however, still low given the travel restrictions which were there still in that year. Year 2022 and 23 marked a significant comeback by the medical tourist, though marred by geopolitical factors to some extent. and we expect medical tourists to register further growth from current year onwards. India ranks amongst the top 10 countries for medical tourism and is most preferred, especially among the Asian countries. Major reasons for rising medical tourism are cost of treatment in India is lower by 70 to 80% compared to that in the US and also fares lower compared to other nations in Southeast Asia. We get quality healthcare at reasonable prices, and the medical tourism industry is expected to grow further, driven by Government of India initiatives such as Heal in India. This particularly benefits the hospitals in metro cities the most as they are prime beneficiary from international patient flow. Nearly 88% of medical tourists arriving in India are from countries like Africa, West Asia, and other South Asian nations. Also, medical tourists arriving from United Kingdom and Canada are on the rise. The healthcare industry, like other industries, is constantly evolving in terms of technology, developments in information technology, which helped create systems that ensure faster and reliable services. In the current slide, we have depicted the emerging trend in the hospital space in India. All these are transforming the healthcare facilities by enhancing the efficiency, improving the patient outcomes, and empowering the providers with data driven insights, as they can help the health providers to increase efficiency and drive growth going forward. The current slide presents the number of PE deals that have taken place during past 3 to 4 years. It is observed that whether it is pharma or hospital sector, the global PE players are showing their keen interest to acquire the stake. And also, we have seen a lot of bigger players acquiring small hospitals and some consolidation playing out in the sector, which in our view shall lead to the long-term efficiencies. However, we shall delve on these more with the panelists at a later point in time. Exhibit 11 presents trends over the years in average revenue per occupied bed, which is RPOB. Here, the green bars represents RPOB and blue line represents the year-on-year growth in RPOB. The data is for a set of 9 listed players in the industry. The growth over the years has been healthy in this parameter, except the period when COVID had struck. RPOB is typically a function of case mix, payer mix, rising surgeries, and annual price hikes by the players. After COVID-19, rising awareness of insurance benefits led to more people opting for health insurance, and the hospitals have been focusing on high-end specialty treatment such as oncology, transplant, and neurology. These treatments are high-paying surgeries which have led to increase in overall RPOB. The sector demonstrated a phenomenal growth of 9.5 to 11% in RPOB in fiscal 2023 to 2024 on a high base of 2022. We expect that the industry will record a 4 to 5.5% growth in RPOB for the next 2 years. Healthy RPOB growth also resulted into soaring cash flows in the industry, which led to new capex cycle as explained in next slide through exhibit 12 and 13. Looking at the healthy demand drivers and need for quality healthcare and rising occupancy levels, players have announced capacities both green and brownfield. As shown in Exhibit 13, it is expected that close to 9,000 to 10,000 beds for the sample set of 9 listed players being analyzed by CARE will come up over next 2 to 3 years across various geographies. The occupancy levels and RPOB therefore may moderate marginally due to upcoming fresh bed capacity in the industry. The occupancy levels are, however, expected to remain range-bound and strong at 64% even on a higher bed base, on the back of rising awareness for health, deeper insurance penetration, rising chronic ailments, surgeries, and medical tourism gaining traction. Let us have a look at the payer mix for the industry in Exhibit 15. Cash and insurance tops the industry payer mix. The share of insurance and international patients has been increasing, which is the higher margin business. The current industry average in the revenue mix is about 34% for insurance and 11% for international patients. However, the collection cycle in insurance is about 30 to 50 days, while cash and self-pay is quick and the most efficient amongst all the options. While the average realization per patient is relatively low for those with insurance versus out-of-pocket payments, insured patients tend to have improved service expectations due to their investments in healthcare premiums. This not only enhances better service requirement but also improves the occupancy of hospitals, thereby driving superior operating leverage. Accordingly, increased insurance penetration is providing better visibility of earnings growth. As we move forward, we expect that insurance and international mix should expand in the total pie on account of rising insurance penetration and coverage with rising medical tourism. Moving on to the credit profile of players and CareEdge outlook. In line with continuous growth in RPOB, the revenue as well has been growing at a steady pace, except the COVID stuck year, which is FY21, when the sector reported marginal degrowth due to fall in occupancy and ARPOB. Post-COVID, with confluence of positives playing to cushion the ARPOB and occupancy growth, the revenue registered a healthy growth as depicted in Exhibit 16. We are expecting the growth momentum in the industry to continue with a CAGR of 10 to 12% over next 2 to 3 years, even on a higher bed base. Let us now have a look at the operating margin profile of the players. The average for the industry players being taken as a sample here. These players used to report margin in the range of 12 to 15% pre-COVID, which improved and sustained at around 19% in last 2 to 3 years, driven by various cost optimization measures, which along with the improving ARPOB and operating leverage, helped the players to report an impressive improvement in the operating margin profile. Operating margins, as per our estimates, is likely to be range-bound at 18 to 19% going forward, as the new supply will come up, but additional levers like rising insurance, international patients, clinical mix shall prevent any major fall in operating margins. Let us also have a look at ROCE in the sector, which are presented in Exhibit 17. Being a high gestation business, which greenfield hospitals usually take about 3 to 5 years to break even, and lower profitability in the past, the ROCE in the coverage universe of players has been low in past years, and it significantly plunged in the COVID year. However, with the improvement in operating margins, the ROCE also improved to over 17% in fiscal 2022 to 2024. Now, with new supply coming in and a large chunk of this being brownfield expansion, we expect that ROCE will moderate from a high of 17 to 18%, but remain healthy and above pre-COVID levels. Let us now have a closer look at the leverage position for the sample set of players. With improvement in operating profitability, the cash accruals also increased and players have significantly deleveraged over last 3 to 4 years. The net leverage, that is net debt to EBITDA, used to be around 3 times in FY20, which now has improved significantly to 0.63 levels in fiscal 2024, as depicted in Exhibit 18. We expect the leverage indicator will moderate marginally from fiscal 2024 level as players resort to expansion mode part, which will be debt funded but expected to remain strong and healthy for the next 2 years. Exhibit 19 shows the CARES rated portfolio in hospital sector. We at CareEdge rate around 77 companies across small, mid, and large size hospitals, and a significant 75% of the portfolio is investment grade, which is BBB and above rating brackets, while the 52% is A and AA rated. Since the sector has performed well, the credit ratio in the sector for the care rated universe has been healthy. Credit ratio is the ratio of upgrade to downgrade for a given period. Post-COVID, sector has reported credit ratio which has peaked to around 10, which means CARE did 10 upgrades for 1 downgrade, and it stayed healthy in FY24 and even in H1 FY25 at around 6 to 7. We have almost come to the end of the presentation. We have briefly summarized here driving factors and emerging trends in the sector along with key monitorables. Going through, emerging trends and drivers are demand in healthcare industry through health insurance penetration and rising awareness, which is a positive. Medical tourism offers a huge scope for the domestic players, and India has of late gained a lot of recognition. We believe that the overall contribution for medical tourism, ramping up diagnostics and specialty mix, will support the growth in the sector as it moves ahead in its growth journey. In last few years, we have seen a lot of evolvements has happened on technology front in the healthcare sector. We see robotic and AI gaining traction, which will also increase efficiencies and reshape the industry. On monitorable side, while the impact of the regulatory intervention on the industry players had not been significant so far, any stringent or adverse regulations, if any, can impact the pricing power and margins of the players. A price ceiling on specific essential and epidemic-related treatments in the interest of public at large can also impact the revenue growth and profitability of the industry players. Any event-based litigation or reputation risk continues to be a key monitorable for credit profile of any player. Players have announced capacity expansion and some are scouting aggressively for the inorganic route as well. Any significant debt-funded acquisition or capex may impact the credit profile of few players. Lastly, the sector is growing and there is a need for quality healthcare in the nation, and therefore the growth in the sector has to be complemented well with quality healthcare and personnel as well. These quality healthcare personnel have a cost attached to them. Hence, both the factors need to be cautiously factored in while planning the expansion. With this, we come to the end of our presentation. Thank you, everyone. I now hand over to Mamta to take the session forward. Over to you, Mamta.
Thank you, Bhavna. Attendees are requested to key in their questions, which we will take up after our panel discussion. Now, may I invite Sabyasachi Majumdar to take over the session, please. Sabyasachi Majumdar is a Senior Director, Ratings at CareEdge. He has over 25 years of experience in credit rating and sectoral research across diverse sectors such as power, renewable energy, cement, sugar, chemicals, oil and gas, etc. He is an alumnus of IIM Lucknow and Delhi College of Engineering. Over to you, Sabyasachi.
Yeah, thank you, Mamta, and very warm welcome to all our esteemed guests as well as panelists. And also thank you, Bhavna, for a very comprehensive presentation, which has set the context very well for our panel discussion today. So first, let me begin by introducing you to our esteemed list of panelists, and would like to thank all of them for having taken their valuable time out for gracing our occasion. Our first panelist is Ms. Ruby Ritolia, CFO of Healthcare Global. She's a chartered accountant by profession and has had industry experience of over 18 years. She's currently the CFO of Healthcare Global, but before that, she has worked with companies like Marico, Hindustan Unilever, and Nestle India. Our second panelist is Mr. Vishal Arora. He's the Chief of Business Transformation and Operational Excellence for Artemis Hospitals. He's a qualified medical doctor with an MBA in healthcare from IIHMR Jaipur and a leadership program from the prestigious SIAM Ahmedabad. He has more than 15 years of work experience with various healthcare providers in India as well as the big four consulting firms. Our third panelist, Mr. Abhishek Singh, he's ED Deloitte. He's a healthcare management graduate. He did his MBA healthcare from IMS Indore, and he leads the healthcare sector across the financial advisory services, and is also a founding team member of Max Healthcare. He now leads the healthcare advisory at Deloitte and focuses on investment banking space. And prior to joining Deloitte, he has also worked with PwC, Crystal Advisory, and Technopack. Very warm welcome to all the three of you, and I really appreciate the time that you have taken out for us. And without any further ado, let me go to the questions section. My first question is to Ruby. Now, according to you, what are the key growth drivers for the hospital industry in India? And what is the kind of sense you get about pace? I mean, if there's any number you'd like to hazard for medium-term growth prospects.
Okay. Thank you, Sabyasachi, and a very good evening to all your viewers here. In terms of what we're looking at medical industry, if I see the last 4 to 5 years post COVID, we saw a significant increase in across the hospitals. The RPOPs went up, as you rightly showed in your analysis. The growth has been good. I think the next leg is again about capacity creation, one, and in terms of reaching more far and more wider. Still today, we have a lot of white spaces within India where the primary healthcare and the secondary healthcare is very limited. So there is lots more that we can do. Good thing which is happening that we spoke about in your presentation also was the insurance coverage. But beyond that, even the mass insurance schemes by the government is enabling healthcare players to reach far and wider to tier 2 and tier 3 towns. I will also add a little bit anecdotal about oncology. Since I come from oncology based hospital chain, there's a data which came out that we are of course the third largest in the world now in cancer patients that we have. 1 in every 9 Indian will have cancer or is poised to suffer from cancer by FY25. Two-thirds of them are being diagnosed only at the advanced stages, and hence our outcomes are not as good because the earlier you diagnose, the better you can do for the industry. This alone can give you a landscape of how much more that there is to be done within India itself. We talk about medical tourism, but within India itself, how much more needs to be done in this sphere. From a FICCI data, which I would like to quote, in 700 plus districts in India, only about 130 of them have a comprehensive cancer care center. So the data that I'm quoting is all reported cancer cases. There could be many, many more where we are not even reporting those numbers. So I think, as rightly being quoted by many people now, in terms of one of the focus sectors, which is attracting investments as well as driving growth, healthcare is definitely one of them. And I see it as a decadal story, which will continue over the next couple of decades as well.
Okay. Now, related to that, I've just one more question, if you can touch upon, how important is the international medical tourism business, and what can the government do to further increase the business prospect, and how much business it could bring to the leading hospital chains?
See, medical tourism is a great opportunity for the healthcare in India. If I were to just explain in a little bit more generic terms, which all of us can understand very clearly, if you see the level of care that we can offer in terms of the medicine availability, the technological availability, in terms of the quality of talent that we have, it is comparable to any other top-notch Western countries at almost a quarter of the cost. Now, this presents a unique opportunity for us to attract patients from all over the world. However, that has not been the reality in the past. If we see, large part of medical tourism is coming from Bangladesh, and then there are certain African markets and Middle Eastern markets from where it is coming. Now, where we are to where we can potentially go, given the cost and the expertise that we possess, I feel there are two things that we need to factor into it. One is the standardized care approach, with now government bringing in NABH and all accreditation happening, Heal by India, Heal in India related initiatives. Quality to some extent will get taken care of. And the logistical part of enabling visas, government bodies, those things are something which is logistical, which definitely has started happening, but a lot more needs to be done. The second part I feel which is more difficult is the entire academics oriented approach to medicine. See, perception is what is reality today. Given we know that we are comparable to any other person in any other country with respect to the quality of care that we can offer, but is that the right perception which the rest of the world carries? So we need to play at that game. And I think one of the things that we need to do is be forefront of academics. We are seen as maybe great followers, but we are not seen as innovators and thinkers. I think all healthcare, including private, public, everybody is working in silos. The amount of patients that we have to deal with, public sector alone is not able to handle that, will not be able to handle that. So I think towards academics and research, we need to come together as a country to create our brand name and to change that perception. I think from a long-term perspective, I think these two measures will go a long way in catapulting the growth in medical tourism. Else, I feel that in the next 3 to 4 years, we can expect a similar growth in medical tourism as we will see in global healthcare business.
Yeah, okay. That's great to hear from you. Now, my next question is to Vishal. Vishal, my question to you, there's been a lot of government push towards healthcare. I mean, healthcare spending by the government is increasing year on year. However, if you see the infrastructure in India in terms of beds, doctors or nursing staff per capita, it still seems to be much lower than those of other developed countries. So, what are the key challenges and what are the potential solutions to address these disparities in the Indian healthcare system?
Yeah, good afternoon, everyone. And first of all, I'd like to thank everyone for inviting me over this. And thank you, Bhavna, for the wonderful presentation. So before moving to your question, Sabyasachi, I'll answer the previous bit first on the medical tourism, because that is something close to very close to us as Artemis. Because as you showed in the presentation, roughly 11% of the revenues coming from international. Artemis would be an outlier there. We do roughly 28-30% of the revenue coming from medical tourism. So, and roughly 30 plus countries is where we attract the patients from. So, and your question was exactly on how can government help us? So maybe that's something very close to us. So because if the visa process are facilitated faster, if the connectivity improves, right? So direct flights to certain countries like Indonesia, etc., are very limited. So if the flights connectivity improves, this all definitely helps. We roughly do at 1/10 of the pricing globally what the patient cost to the patient would be. In India, it would be 1/10 of the cost, and patients are happy to come. And for us as hospital providers, the blended ARPOBs, if you're talking about 60, 70,000, international patient ARPOB would be around 1,20,000, 1,30,000, if not more. So that's the difference. It comes, and it is all cash business, right? It's a handy cash business. So from a administrator's point of view, the more I get, the merrier it is, and the interventions the government take, we're more than happy to take that up. Moving on to the other part of it. So as you asked, the infrastructure availability in the country and how it is. So as the presentation also showed, right, 3.83% of the GDP spent on healthcare, out of which 1.84% is only public. Rest it is entirely private. Roughly around the recent NHA report which was released, roughly around 40% of the expenditure is still out of pocket by the patient, right? So government, though on one uh, end it is trying to bring up schemes like Ayushman Bharat, but at the same time, I'll give you a stat analysis which I was doing for few listed entities. If a cash patient is required to pay 100 rupees for a service in the country, the same hospital, a PSU patient or a Ayushman Bharat patient would end up paying around 35 or 36 rupees. Now, we all know that healthcare is at a 60, 65, at a 20, 25% margin, right? So cash patient eventually ends up cross subsidizing for the panel patients. The realization from a TPA patient would be something 10, 15% lesser because of the discounts and everything offered. So, on an overall thing, if the government is trying to bring in the infrastructure by moving from the provider to a payer concept, which the government is interested to, they want to be a payer for the long term, which is coming out in the policies. But the price at which they are paying, many hospitals would be deterrent to take in the patients because of the realizations, right? So if we at Artemis have a RPOB of something around 75 to 80,000, my panel RPOB would stand around 30, 35,000, which is way beyond my threshold level as well to break even. So that is the reason this gap is there. So government needs to look into the policies and the price points and maybe come up with a grading metric. So they have put us at par with a hospital or any private hospital at par with a nursing home as well, right? So they need to come up with a grading hospital if a patient is treated at a government hospital versus a patient being treated at a nursing home versus a patient being treated at a quaternary care center. The prices offered by the government cannot be same. So that is something if government looks up to the thing and they move on the NHS, the idea is to move on to the NHS model and merge all the health schemes. Currently, roughly around 50 health schemes run across different states and across the country. So idea is to merge everything and have one scheme, which is the Ayushman Bharat scheme. And if the price point are looked upon, and hospitals will be more than happy to take these patients, and this will serve as the biggest solution to the initiative the government is trying to take to. So hospitals will be happy to take those patients because government, one thing for us, which all of us can agree on, is the money by the government can be delayed but will not be deferred, right? So which is always a comfort. So that would stand in my books and would eventually accrue to my P&L. And hospitals are happy to extend that credit line as well. I am sure Ruby would also agree with me while I say that. So if the prices are looked into, I think this problem of supply and government moving from a provider to a payer concept would definitely gel in well.
No, my related question also was to, the supply of nursing and doctors. I mean, one of the issues, I mean, agreed the infrastructure part will be created, but where do you get the doctors, paramedics, nurses? I mean, how do you build up that infrastructure for,
I have a very I'll share a very candid thing. So most of the Indian doctors are going abroad. Most of the nurses are going abroad because of the price point, which is the packages or the salaries offered to them, or the technical advancements which we do not have in the country, right? So if we are able to plug the thing, right, every year 1,15,000 MBBS students pass out. The country has roughly around 20 lakh doctors available in the country, which is not a bad number. So but the problem is the drain out. People like me who move from the profession to the admin part of it, because there are the way the doctors are left in the country, 24-hour shifts, 36-hour shifts. So the way it is treated, and it is not the deficit in terms of the doctor availability. It is more towards the way they are being treated. And I'll say the current scenario in the hospital in terms of the payouts to the doctors and everyone, because hospitals are realizing less, they are paying out less, and even the pressure from the these panel patients and everything. So all the problems, if dealt at tandem, it definitely gives a solution to everything. There is, in terms of dearth, true dearth, there is not a dearth. It is just because of the brain drain happening. We are in a situation where the dearth comes up.
Thanks. Thanks. That was a very useful perspective. So now I move over to Abhishek. Now, Abhishek, what according to you are the key growth drivers that are shaping the healthcare sector? And do you see, given the fact that India is an under-penetrated market, do you see there being a multi-decadal opportunity in the sector with an under-penetrated market? Aging population. I mean, we'll also have to face the aging population, end of life, kind of segment will become very big in the future. So, how do you see the healthcare market growing?
No, so sure. Thanks, Sabyasachi, and thanks, Bhavna and Ravli and everyone for bringing me in onto this. So my answer is honestly not very different from what Bhavna already portrayed in the presentation. It is, and like Ruby also mentioned, it is a long-term story, overall healthcare. The only thing I would want to add is, while we are talking conventional hospital of the Fortis, HCG, Apollo, Max, what's also going to drive is the factor that with new schemes, Ayushman Bharat, let's say in the last 5 years have come in, such schemes are also going to add more segmentation in this play, which means we are going to look at more low-cost players. We are going to see segmentation, and segmentation is really the play. It happens in any industry when there is maturity setting in. We would see more type of players. So, like you see, HCG, for example, it's more specialty focused. So, more specialty focused play will come in. More segmentation. When I say low cost, middle cost, and up, the premium segment as well. So, while we count the Maxes and the Apollos for that matter, or Artemis for that matter, in there will be more premium play, a bigger premium to these organizations, and it will be a boutique play. So it will be a layer added up, and there will be a layer added below as well from that point of view. And there are customers, there are players who will address that. Beyond all of that, I would also want to mention that healthcare is also opening up for unconventional play, or rather the conventional play of Ayurveda and Ayush medicine, etc., also going to be coming in gradually. I think there is no denying the fact that people are also becoming more conscious. In my view, health consciousness is growing, and people are opting for healthier decisions. So I would also put my bet on situations where Ayurvedic players you will start seeing them. It is very, very early stages, but you will see them coming in gradually to compete, at least in the primary care segment, and probably in some situations, secondary care segments also. Tertiary care, of course, tertiary care is, you need all the paraphernalia of a big setup of a hospital, the equipment and all of that. But primary and secondary, I believe these players, the conventional players, will start trickling in and start taking a larger pie in the share. So I think that's also happening. And of course, insurance and affordability, everything increasing. It's a play which is only going to go from tier 1 to tier 2, tier 3, tier 4. Everyone, there is so much market that we have that we will start doing that. Honestly, I don't look too much on medical tourism. If you ask me, India itself is such a big market. while medical tourism will cater to a percentage of business for the top players in the metro towns, I think the bigger story for us is tier two, tier three, tier four. So people will start looking at that, and why I also say that is not to discount out medical tourism. In my view, healthcare is a very neighborhood business. Ultimately, you would want to go to a player which is giving you good service, competitive service in your neighborhood, and you can travel a bit, but as far as possible, you will not want to travel a lot. And that's why medical tourism will only cater to a small segment where things are not available in countries where they come from, and that's why I don't count too much on it, honestly. And last point, but I would also not want medical tourism to take a large percentage of the business, if you ask me. We have seen Thailand example when there was an issue in Thailand a few years back. One of the biggest hospitals which started this medical tourism concept about 20-25 years back, Bumrungrad Hospital. When Thailand issue happened, emergency happened, that hospital's business dropped drastically, right? And we would not want to do and see that happening to us. We would rather have more dependency coming from the local base of patients, which is more robust for all businesses. So I would just hold there.
As I see it, there seems to be a unanimity in the panel that the healthcare business is likely to see a very healthy growth without international tourism, given the fact that we still have so much potential to tap within the own country. So from revenue and top line, I mean, now that we have a consensus that the revenue and the top line is kind of go, I would like to move focus a little bit on the operational side. So my question to Ruby you is, it has been a RPOB led growth post COVID. So do you see this RPOB expansion keeping pace, and how also do you see, I mean, there will be new kind of investments are taking place in specialized infrastructure. Then you have new concepts like robotic surgeries, advanced ICUs, high-end diagnostic centers. So how do you see the RPOP story panning out in the medium term?
Correct, correct. Thank you for that question. I think it is important. A lot of people estimate RPOP to be price growth, but that's not really the truth. Price of that would be a very small part of it. The large part of the RPOP growth which is happening is more investment coming into newer technologies, better care being available and accessible to people. Because of insurance coverages going up, access to some of these is going higher. For example, before COVID, we were at an average of 2 lakhs of insurance premium. Today, we are looking at about 5 lakhs of insurance coverage for in general. In insurance, private insurance coverage is average is 5 lakhs. That enables people to access more advanced medical care, and that is the leading factor of the RPOP growth that we have seen in the past. I also feel that that is going to continue in future as well. The pricing part of it is going to be limited. I think it will differ from different specialities, but at least in oncology, for us, I can say that it is not more than 1 to 2% in pricing. The rest coming from a lot of mixed factors. Just to give you an example, in fact, if I talk about oncology, there are four revenue streams that are available. One is diagnostic, where you do PET scans and other to diagnose the cancer and to decide the treatment protocol. Then there is chemotherapies, which is again pharma being used in infusion. Then there is radiation, which is a very heavy investment line where you have to invest in Linacs, which is extremely high investment, capital intensive. And the fourth one is surgery. Out of these four streams, the bed dependency is only on surgery. Rest everything is on an outpatient basis. So the moment you start sweating your assets, even in radiation, even in chemotherapies go up, most amount of trials are happening in pharma sector, in oncology drugs, where targeted therapy, immunotherapy, a lot of cutting edge diagnostic where lung cancer is no longer treated as only a lung cancer, but various advanced diagnostics are attached to it to determine the mutation with which it is taking and giving a very personalized care. All of this is also leading to an RPOP growth, which is going to continue because at least cancer as a stream, the protocols are changing every 45 days. Uh, and a comprehensive cancer care facility, which includes all four different modalities being available for patient care, is driving up that RPOP in the market. And just to add on to one of your previous questions on us being able to create a very viable business model from government schemes, I think the industry also have to be a little bit more nimble and agile towards that. We went into tier 2 tier 3 markets long ago than anybody ever thought of going into tier 2 tier 3 markets. We are present in markets like Cuttack, Vizag, and these units are generating as good an EBITDA as any of our Bangalore centers can generate. We have to figure out a model as to bed combinations, sweating of the asset, what level of infrastructure do we want to create, the number of beds that you want to create, the flexibility that you have in taking up the infrastructure, the flexibility that you have in investing in your doctor and nursing talent at the right time. I think these operational levers also play a very important role for us to be able to create a better business case within the confines of different schemes that we have and still be able to create a very healthy business model which is beneficial for, of course, the patients because they get access to care, and for the companies also because they get a huge amount of white space where people now can take the treatment which were earlier were not able to.
Yeah, thanks. Vishal, my question to you is, there have been a rise of other kind of services like telemedicine and home care services. So how do you see these segments impacting the ARPOB and occupancy rates? Do you see them as complementing the hospital revenue, or do you see them as, cannibalizing the inpatient revenues? How do you see, net, how does it impact the major hospital chains?
So yes, thank you for this question. So I think this is always complementing the hospital revenue, not cannibalizing, because this frees up my bandwidth to get in more patients as the footfalls in the hospitals are significant. So having a dedicated home care service where I can reach out to the patients who are not willing to come to the hospital, that's one space which is helping the industry. Most of the leading players in the country have come up with the home healthcare services for that reason. Second, also, it frees up the doctor's bandwidth. So, if you are, it saves significant time for the patient as well. So, if a patient is required, once the patient comes to the OPD, right, his follow-ups can definitely, first OPD, second, third follow-ups can definitely happen on teleconsult where the doctors knows the history and it's just a follow-up for the previous consult, or maybe a post-surgical discharge consultation, first line of treatment. It definitely frees up the bandwidth for both the hospital and the doctors as well as, and helps hospital increase the throughput. So the view I see it from, it is definitely adding on to the thing. Also, the the load on the infrastructure, right? So the crowded spaces and everything that goes away because we have limited resources, the car park problems and everything. So it helps the hospital in a multitude of factors, and on a summing note, it definitely helps up the hospitals to add on to the revenue streams.
Okay, great. Abhishek, my question to you is on the overall operating. I mean, what is your prognosis on the long-term operating margins of the hospitals? Now, what we have seen in the last couple of years is that the players have been able to sweat their assets, and there's been a lot of cost optimization. But now, with a lot of new capacities also coming up, do you see this margin sustaining? Because one, there will be competition, and of course, with new hospitals coming into place, they would be still be at a relatively lower, operating margin point. So, how do you see the operating margins panning out for the hospitals?
Um, I don't see, honestly, much risk to that because while the capacity is building up, the affordability is also expanding. The more volume of people are adding to the middle class and above and all that. So all that is happening in concurrence. I see the only risk coming in, honestly, and is which also happened in the past, was some capping or the other from the government, if at all it comes in some form. If that comes in as a knee jerk in between, which has done in the past, like it happened on the stents, and then it happened on the implants. So those kind of pieces, if they come in, are probably going to normalize a bit. Uh, but if you ask me, when it happened in the past, whenever it happened in the past, it did dip the margins for a small moment, but then everything rationalized. The value chain system, the supply chain in the process also did do go through some correction, and everyone is back to normal. So while the quantum decreased, but the volume increased over a period of time, and so that's why, while I do put it as a risk, in my view, in my own personal view, I think uh, the healthcare, private healthcare is innovative enough. People are entrepreneurial. It will be normalized if at all. The only thing is, we have to check. We have to keep our internal checks and balances on that point. I would just leave it at that.
Okay. Vishal, your take on the margins. How do you see the margins panning out for the industry?
So, can you please repeat the question? Sorry, I
Yeah,
missed it.
how do you see the operating margins panning out for the
So operating
healthcare sector?
margins in the industry, as the deck also showed, right? So pre-COVID, it has gone up from 16, 17% blended. So most of the hospitals recording 20% plus now. And the major reason for this would be, one, I'll say the COVID has taught us to, COVID in terms of margin was a blessing in disguise. It taught us to cut on the fringe, no fringe kind of a hospital. So whatever uh, value adds which we were giving, and wherever we could leverage operational efficiencies, that is one thing COVID has taught us, and also taught us to increase the throughputs. The hospitals which were averaging an occupancy of 60, 65 now are easily managing an occupancy of 75 to 80%. So all these throughput expansions and cutting on the non-required costs has helped us leverage the efficiencies. Of course, as we've discussed, and that came out on unanimity with everyone, the increasing affordability has also helped us, because the realizations or the RPOBs are growing at a 7 to 8% year on year thing, and the cost is going around 5-6%. So 1 to 2% every year we are able to leverage basis the affordability, changing case mix, changing pair mix. Also, one thing which has come up very beautifully is the reducing length of stay, which used to be averaging around 4.5. Now 3.6, 3.7 is what most of the hospitals are able to leverage. So that leaves us with another 5% of the operational efficiencies, and the trend has to go on. So the 25% plus EBITDA margins is what most of the hospitals desire, and I think in a span of 3 to 5 years that should become the trend, right? As now we are able to say we are 20 plus, most of the hospitals should be in 25 plus bracket in next 3 to 5 years.
Okay, thanks. Ruby, your take on the margins?
Right. No, I think I agree with the panel here. I think 20% is something that is going to be the norm, which is going to happen with the existing landscape, with the existing footprint that all of us have, and the expansion and the amount of investments coming into the sector. I feel that synergies of scale, which will keep on adding, and that may increase because of operational efficiencies coming in. That may further then inch up margins going forward. But I think 20% is a good benchmark to look at and to maintain at, because it's also important to make the right investment decisions. So it's important to balance between margin expansion versus new capacities going into new geographies and creating future growth vectors. So I think 20% would be a more realistic number in more medium term outlook. In a longer term outlook, yes, operational efficiencies will start coming in.
Okay. So good. I think it's good to hear from the panel that there seems to be unanimity both on the volumes as well as on the operating margin side, that the industry is very well poised. So I'll move to my last set of questions, which is towards the market structure, basically about the consolidation. So my question to you, Ruby, is how do you see? I mean, there have been a fair amount of M&A activities in the past with some of the bigger players taking over smaller players. There has been some PE interest in the sector as well. So how do you see consolidation playing out in the sector? Do you see it continuing, and we would have a smaller number of very large chains, or the industry would more or less remain where it is? Industry sector would remain more or less where we are right now.
So see, if you see, India remains a very attractive market for investments. On that, if you see, healthcare is one of the sectors which remains very attractive. The past growth and the future, the drivers that we have discussed. Given these positives, it is very natural for the sector to attract more investments, whether it comes in the form of M&A consolidation. It is good for the sector because it helps in standardization of care, and this is going to continue. Anything which is attractive from a return perspective, we are talking about 20% return, which in just if you go back 5 years, people used to talk about healthcare as a 13 to 15% margin profile. Now we are talking about 20%. So anything which is an attractive sector poised to grow, relatively insulated from the consumption cycles in the country, it is a very attractive sector and will continue to attract investments. And whether it comes in the form of consolidation or new setups coming in, I think that is something that anybody can guess. But I still feel that the investments will continue to come in the sector.
Okay. Great. Vishal, my question to you is, as a part of these, growth and, M&A which is taking place, we are seeing, hospital chains which are traditionally very strong in one pocket, acquiring chains or individual hospitals in other other regions where they have historically not operated. So do you see some drawbacks coming out of that? I mean, do you feel that it would be possible for some of these hospital chains to have the same kind of margins, the same kind of brand equity in new markets? Do you see that adversely impacting some of the growing organizations?
Yes, I honestly, the answer would be yes. For bigger chains, they are creating a monopoly, and this will help. This will reduce the competition in the smaller places where the bigger giants are coming up, and the monopoly would come in, and thereby having a lot of pressure on the smaller hospitals to perform. So they'll be required with they'll be under huge pressure to perform or perish. So that's how it would poise in the medium term, right? So medium to long term. So a lot of pressure coming on the smaller hospitals, and bigger ones coming as a threat to them.
Okay. My question to you, Abhishek, is, now 100% FDI is allowed, in the automatic route for greenfield projects, and we are seeing a lot of, foreign, capital coming in the form of PE as well as venture capital investments. So, do you see these investments as bringing about, upgrades in the healthcare sector? Do you see them as improving the quality of the healthcare facility? What are the apart from just the capital, what else does this international investment bring into the domestic healthcare sector?
So actually, FDI has been there 100% allowed through the automatic route since last 15-20 years in healthcare. It's nothing new. And honestly, the fact that private equity players came in, I'm talking of 2003, and then really the momentum started from 2007-8, and I was lucky to be part of some of the few deals initially that it started. Uh, they have been big supporters of the private healthcare because they saw that happening in the developed countries, and when they started pumping money into private sector, HCG being an example, the first tranche probably came in early 2005 or 6, if I'm not wrong, or maybe slightly later, or 7 or 8. But
After IPO, the private equity, the first tranche, yes, came in that time.
I'm talking the first tranche, So, and the first tranche in Max, where I was part of, it came in 2001-2 in IFC through IFC. So private, FDI has been a very very helpful body of investment coming in. And private equity support is the reason why you see so much growth happening in India. Uh, 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 Having said that, and to your point, Sabyasachi, I think it surely, the more money coming into the system, into the country, it is all getting spread in the right reasons, whether it is new infrastructure creation or processes and investments, etc. Eventually, because this is becoming an attractive sector, even domestic investors are looking at this, and that's why you see more investments happening in tier 3, tier 4, tier 2 markets happening for that. So it's a convection current, really helping everyone draw up. And the salaries, etc., has also grown. As the country has grown, the salaries have also grown. Of course, in some pockets, like Vishal was talking, for the some of the doctors, it may not be still attractive, in at least in the initial stages. But yeah, things have grown, and it's been a positive influence all through. If you ask me, at some point in time, I would also expect that Indian healthcare, as it is growing, we will have more confidence to do acquisitions outside of India. And HCG, for example, already has presence in Kenya, and others are also going to look at opportunities outside of India, because we have such talent available in house, which is anyways going out, right? When they get job opportunities, they go to US, UK, and other parts. Uh, NH is running a very profitable hospital in Caribbean islands there. So those are examples which I think we will have more of happening, and I think it is a positive from all sides. Yeah.
Thanks. I just will ask one final question to you, Abhishek. Maybe Ruby also you can pitch in. Vishal had raised a very interesting point. I mean, a very important point, that we are losing a lot of talent, and to basically doctors, paramedics, nurses, etc. And given the aging population and the rising cost structures in the developed markets, and maybe even the Gulf countries, that brain drain is only likely to become worse. So one, of course, Vishal suggested that if the industry realization improves, their ability to pay the staff will also improve, which could help in retaining the staff. But what else can we do to retain our best talent? Maybe Ruby and Abhishek, if you have any thoughts, you can share with us before I go to the audience question. One last quick word from you on this issue.
Ruby, why don't you take it up if you have?
Sure, sure. See, I think if you consider any developing economy, why are we singling out healthcare? In which sector is the talent not going abroad?
Correct.
But that doesn't stop us from creating our own talent pool. That doesn't stop us from being very, very developed in IT infrastructure, from an IT supply service provider point of view, when we have the top talents going to Silicon Valley in the US and other places. Similar is the case with medical also. But I think the kind of population that we have, the kind of education orientation that this country has, I think we can supply manpower both for internal, domestic as well as international
No, that's
requirements.
good to hear, because just yesterday or day before I was reading somewhere that, Germany wants to recruit some 50,000 more nurses from India. So I was a bit scared. I mean, how do we, and even if I hadn't been, hosting this webinar, I'd have been very worried as to,
So the
the
good part is
paramedics.
India works very, very fast in terms of plugging in demand and supply situation. There is a good amount of talent which is looking for a good paying, respectable work. It's just a matter of time when we will catch up. The education infrastructure will catch up on that, and we will do it. Of course, it requires effort, like it requires effort in any other field. Similarly, it will require in the medical field as well.
Okay. Yeah, thanks. So there are a couple of, audience questions. I would like to take them up.
Just
First,
add, sorry,
yeah,
just to
sure.
add to what Ruby said, and I just complimenting what she said, I think it's a positive. I would also say, because people have gone out and they have exposure, it helps the Indian healthcare also, to understand what's really going at the best of the organizations and the places, because we have that transfusion. So it does help. In fact, if you ask me, I think we are underplaying our resources, at least on the nursing side. I think there is a lot of focus whenever it comes to human resources. We talk of how many medical colleges are we opening. So there is a lot of focus that is going into medical colleges. But if you ask me, the easier bit is if we can do more nursing colleges, and if we can churn out more nurses, it will only not only help India, and we have so many such population available. They are looking out for jobs. This is one profession where they will not be jobless. I think, if to your earlier question, Sabyasachi, government infusion or focus, if I would rather tell them to go into nursing education more than the doctor education. Of course, doctor education is also important. Not discounting that, but I think this is an easier part, and quick achievement can be done.
Thanks. So there are a couple of audience questions. First question is from Mr. Adesh Gosalia. Now his question is, where will the growth be coming from? Is it going to come from general hospitals, or is it going to come from specialty hospitals? So any of you would be willing to take up that question, Ruby or Vishal?
Ma'am, please.
I think everywhere.
Please go ahead. Please go ahead. Yeah.
So
I think everywhere. Yeah.
everywhere, yeah, that's the right answer. So both the segments, it would be, it will not be specific to a segment of the thing, depending upon where you are and what you provide. Because right now, as Abhishek also mentioned, if you are in tier 2, tier 3 cities, the supply is to be met. The demand is already there. So you just need to plug in with the supply point of it to the undersupplied areas. So growth is in all segments, everywhere throughout.
Okay. Great.
Just to add on to that, if you see even oncology, just few years ago, it was not where private was putting focus on. It was left to the trust hospitals and the government hospitals to deal with it. It was a difficult disease. It was with bad outcomes, and private was not ready to invest into it. But today, look at the HCG alone has about 25 hospitals in the country. So the footprint is only increasing. More and more quality of care will matter more than whether it comes from which specialization and where. I think access to novel care, access to good newer trials, newer technology, adopting AI, adopting robotics. I think those things will become more important, and that will drive growth.
Okay. Thanks. The next question is from Mr. Abhay Vanchu. He has a concern that increased investments by PE firms in the industry, in the hospital industry, since they are typically much focused more on short-term gains, will it impact on the quality of care which is being provided in the hospitals? Anyone of you would like to take that question?
See, I can say that if PEs are becoming more, let's say they have a 3 to 5 year horizon, and that is what typically is what a PE looks at in any other sector also. But what is more important over here is the way they drive standardization of care. They are very, very, in terms of methodical in terms of their approach. That has driven more standardization of care rather than seeing it the other way around, that it will reduce the quality of care. I would rather say that it has increased the quality of care.
Okay. Abhishek, any view on this?
There is, of course, a definite pressure on the businesses to churn, but honestly, private equity organizations are ethical organizations. They won't tell wherever they are sitting on the board. I don't think anyone tells the management to go anywhere unethical. That's I can tell for all private equity organizations. Now, it boils down to the management, of course, as to how they are driving the growth. But I think this question is coming also on the back of the point that RPOBs have increased significantly in the last few years. But that's an inflation. If you see, the country has gone through a certain amount of inflation in other sectors also. The salaries, etc., the doctors have to be paid out. So we have to see that element closely. I don't think we can put the reason of the high growth that we have seen on account of private equity. It is sheer inflation also happening in the country in the last few years.
So thanks to all of you. Since there are no further, questions from the audience, I would like to close the, webinar. I would like to thank all of our three esteemed guests, Ruby, Vishal, as well as Abhishek, for taking out their valuable time and sharing their insights with us. I would also like to thank my colleagues, Ravleen and Bhavna, for having put together such a, informative presentation, which I think really sheds a lot of light on what has been going on the sector. And thanks also to the audience for taking the time out for making part of our webinar. Over to you, Mamta.
Thank you, Sabyasachi, for moderating the session and Bhavna for your presentation. Once again, thanking all our guest speakers for their insightful views. It was a privilege to host you. And lastly, thank you to all the participants for taking the time out and being a part of this CareEdge webinar. For any further queries, feedback, or suggestions, please write to us in the feedback mail. Goodbye for now, requesting the tech team to kindly log off.